Hello there, you're watching TRT World live from London. This is the News Hour with me, Shiulie Ghosh. We start with Freedom Day. That's what today is being called here in the UK, as COVID restrictions are almost completely lifted across England. Masks and social distancing are no longer required by law. Most of the adult population has been vaccinated, and there's no doubt the economy here badly needs a boost. But some experts are saying it's far too soon, and that Prime Minister Boris Johnson is taking a gamble at a time when there's been a huge surge in new cases. Sarah Morris reports.
This is a step into the unknown, a global test case on vaccine efficacy. Workers are being encouraged to gradually return to their offices, but on so-called Freedom Day, the rush hour crowd at London Bridge Station was far from its pre-pandemic size. Mask wearing is now a personal choice rather than a compulsory requirement, and there are no longer any limits on how many people can meet in private homes or gather at public events.
I think it's the right thing to do. People need to be able to start being able to mix. It's gone on for too long.
I think it's too early, in my opinion. The cases, as you're saying, still rising.
In the past week, around 317,000 people in the UK have tested positive for coronavirus. That's an increase of 43.3% on the previous week. Over the same period, an average of 40 people with the virus have died each day. But that's far fewer than the 559 who died on December 14th, when the UK was recording a similar number of infections. The statistics show the vaccine appears to have broken the link between coronavirus infections and deaths. So, with 68% of the adult population double vaccinated here, the government is willing to take a gamble. It's going to let the virus spread and hope there's enough immunity in the community to stop death and hospitalisation rates soaring to the highs they did in the previous waves of the pandemic. But as the images of British nightclubs reopening and life returning to normal are beamed across the world, critics of the policy say it's reckless to lift all the restrictions at once. The Prime Minister, who himself is isolating after his health minister tested positive to the virus, disagrees.
There comes a point after so many have been vaccinated when further restrictions no longer prevent hospitalisations and deaths, but simply delay the inevitable. And so we have to ask ourselves the question, if not now, when?
Governments around the world are expected to be watching England with interest. If the experiment is successful, it could provide a template to follow to return to normality. But if it fails, it could be a warning to other highly vaccinated countries that coronavirus is a problem that's not going away anytime soon. Sarah Morris, TRT World, London.
We can speak to Dr. Bharat Pankhania, a senior clinical lecturer at the University of Exeter Medical School here in the UK. Good to see you. So if we look at the figures, there were 50,000 new cases on Saturday. Cases are obviously increasing. Do you believe we're lifting restrictions too soon in England?
Not only are we lifting restrictions too soon, but we've abandoned all desires to control it going forward. So we've dropped all legal requirements for infection control, like wear your mask, wear it properly, wear it in crowded places. Nightclubs are a big danger point for me. I worry about them a lot. So I feel we're going downhill without our foot on the brake pedal, and it is worrisome.
But hospitalisations and deaths are still relatively low. Isn't it just a case of having to accept that there will be new infections as long as we can protect our health service?
I hear you, and I have to accept that with a heavily immunised adult population, about 2/3, the link between cases and hospitalisations has decreased. Having said that, we've still got a younger population which is not yet fully immunized, and we haven't really got to grips with immunizing 12-year-olds and above. Now, if we were to look at what happened in Israel, Chile, and France, we noticed that when they dropped all their control measures, and Holland as well to include that, when they dropped their control measures, the case numbers soared, And then some people also end up with long COVID. So all I am saying is, of course, we've got to open up. Of course, life has to return to normal. But it is also important to do it slowly, carefully, a small step at a time, and include infection control measures as you go along.
As you were mentioning there, experts now recommending that children aged 12 to 17 be vaccinated. However, they are not the age group which generally tends to get very ill from the coronavirus. So given that most of the population is now vaccinated, it's standing at 68%, at what point do you say, OK, enough of the population is vaccinated so that we can now and try open up a little more to see how the coronavirus impacts on the population?
So there's two answers here. First, with respect to the children, we have to be aware that whilst they may not have severe disease, they do suffer from long COVID. I know all of them don't. The range is between 5 to 15% may go on to have long COVID. So that's important. Furthermore, they're also transmitters of infections to other people and older people, and of course disruptions in school. So it is not to be taken lightly, the not immunizing of children aged 12 to 17. Now, at what stage do we say we drop our guard and continue with business continuity? It's very simple. When the case numbers are down, and when the case numbers are down, not only in the nation, but in the surrounding nations, in the surrounding geographical areas as well, and we feel that Africa, Asia, South America are also in a safer place, we can then start to significantly drop our guard. So I'm afraid it is a long way to go, but we have failed. We have failed in addressing not immunizing Africans, Asians, South Americans at all. And that will come to harm us if we don't watch it.
Thank you very much indeed. Good to get your thoughts there, Dr. Bharat Pankhania.